Everyone. My name is Rachel Rogers. I'm a diabetes educator and I work at North Kansas City Hospital. And I have joined you all today to talk about diabetes numbers. And so that means checking blood sugars, what they mean, and what your doctor is referring to when he talks about those numbers. So we're just going to dive right in, and I hope if you have questions that you shoot me an email afterwards. Okay, so why do we check blood sugars? We want to check your blood sugars to keep your diabetes in check. All right, so we're going to go through the types of numbers you're looking at and what those mean. We're going to go through why it's important to know those numbers. And then we're also going to go through, how do I know my numbers? How do I find out that information? So first, what numbers are you looking at? Okay, so number one is the A1C. An A1C is a 3-month average of blood sugars. And that's actually determined from your red blood cells. So your red blood cells flow through your body for 3 months. And over that time, sugar in your bloodstream sticks to those red blood cells. And so when we look at those also red blood cells in the lab, we can see how much sugar has been on there for about 3 months. And that tells us your average blood sugar. This number is reported in a percentage. It's used for diagnosis. So diabetes, if your doctor says, we just found out you have diabetes, that means your A1C is above 6.5%. And then it also tells us if you have a risk for complications. So if your A1C stays above 7% for a long time, that means your risk of complications like kidney disease and changes in vision and heart disease starts to increase. And so our goal is to get that A1C back to a healthy level. Also, if you look at the A1C, say your doctor says, oh, your A1C is 9%. That means your average blood sugar is around 212. Meaning that before a meal, it might be a little lower, maybe 180, maybe 170. And then after a meal, it's going to be higher, maybe 300. And so we're getting the middle of that, which is 212. All right. And so this is tested at your doctor's office. Typically, when you're first diagnosed with diabetes, if it's above 7%, your doctor's going to want you to test every 3 months until your A1C is less than 7%. Once it's less than 7%, it's considered well managed. And then your doctor may say, you know what, why don't you just come back every 6 months or every 12 months? But that A1C kind of helps us keep track of all your numbers in general. Right? The next is blood sugar or blood glucose. These are the same things. It's just scientifically, sugar is a crystal that forms outside the body, so like sugar that you put in your tea, right? And glucose is actually a different form of sugar that's in our bodies, and that's the breakdown of carbohydrates. So carbohydrates all get digested in our stomach and they turn into sugar. Okay, and so when you check your blood glucose, that is your current concentration of sugar in your body. So what is my blood sugar right now? So remember, the A1C is a 3-month average that tells us in the past, but blood glucose or blood sugar is in this moment how much sugar is in my body. Okay? About 4 grams of glucose, a simple sugar, is always present in your body. So that's not actually a lot, but you still need that amount. Okay? Your blood glucose can vary because of lots of reasons. It can vary because of food, exercise, medication, stress, and insulin resistance. And so all of those come together to really help us manage your blood sugar. Okay, so now you're thinking, should I test my blood sugar? Should I get my A1C checked? Okay, A1C we check for 3 main reasons. One, if you're older than 45, your doctor may check your A1C every 3 years to make sure that you're not developing diabetes. If you're under 45, then your doctor may also check because you may have some risk factors. Some risk factors include being overweight, having a strong family history of diabetes, not like my great step grandmother daughter had diabetes, right? But a first member of your family. Or having medication that can cause elevated blood sugars like steroids or some other autoimmune medications. And then individuals with diabetes will also get their A1C checked. And again, every 3 months. Who should check their blood sugar? So there are two kind of main reasons. One is if you have diabetes, and one is if you have gestational diabetes. So if you don't know what gestational diabetes is, it really is just when you are when a woman is pregnant and develops high blood sugars during pregnancy. Now, if you had diabetes before pregnancy, then it's not considered gestational. It's only if you develop during that while you're pregnant. And so they actually have to check their blood sugar 4 times a day, which is quite a bit. Most people so individuals who are not on insulin don't need to check their blood sugar as often. But patients with type 2 diabetes on pills should still consider checking daily until their blood sugars are well managed, and then maybe 2 or 3 times a week to kind of keep an eye on it in between doctor's visits. Why should you check your blood sugar? So I know that I'm going over things as we kind of go along, but so you'll hear some repetition, but I like to break it down in how we kind of look at blood sugars in general. Okay, so why should you check your numbers? Blood sugar testing provides useful information, and it can actually help you monitor the effect of your medications. How well are they working? Do I need a different medication? Is this causing my blood sugar to be too low too often? It can also help you identify blood sugar levels that are high or low. So you start feeling a little funny, maybe you start feeling weak and shaky. That's a good idea, a good reason to check your blood sugar. And if you look at it and, oh, it's 65, maybe you should treat that low blood sugar. Okay. It also allows you to track your progress in reaching your goals. So if you see your doctor every 3 months and you see this A1C, that's great. And it shows us your progress, but what's happening in between those 3 months? Are you making the changes that you need to make? Are they helping you make progress? Maybe you've made all these changes and you're still not lowering your blood sugar. And that can actually help your doctor say, okay, you know what, you called me, your blood sugars are running high, let's change some things. Maybe it's not your lifestyle that's the problem right now. Maybe you need a different medication. It can also help you learn how diet and exercise changes your blood levels. And we'll talk about that in a little bit with types of monitoring. But you can see, if you were to check your blood sugar after a meal, then you would see, oh, okay, so my blood sugar is high. I ate 4 pancakes. Maybe tomorrow I will try 2 pancakes and check my blood sugar 2 hours later. And you can see how all of that is really affecting your blood sugar. You could also see, okay, I ate some scrambled eggs with some cheese on top and checked 2 hours later, and it didn't change your blood sugar at all. And so that gives that positive reinforcement of, okay, now I know what to do. It also helps you understand other factors such as illness and stress that affect blood sugar. So a good example is my husband has type 1 diabetes, as I'm sure you all know. You've seen the other videos. But his blood sugar starts going up when his allergies start bothering him. Which seems like such a minor thing. Half the population struggles with allergies, and he can watch his blood sugar start to climb over several days, and he'll contact his doctor and say, hey, my allergies are acting up. How can I fix my blood sugar? And she'll actually give him advice on that and tell him how to change his insulin. Also, speaking of insulin, so your dose of insulin may actually change based on your blood sugar. So you should always test if you're giving insulin. You should always test before giving insulin, because who knows, what if your blood sugar is 55? Maybe you shouldn't give your entire dose of insulin at that point because you're already low. Or maybe you should have a snack, give your insulin, and then eat your meal. So there are lots and lots of options. If you want more information, the Mayo Clinic is a wonderful resource, and it talks about why you should check your blood sugar. Okay, so now you're wondering, what am I even looking at? What is my doctor looking at? What are these numbers? Okay, so on the left here, we're going to look at A1C. I hope it's on your left too. Look at the title A1C. And we're going to look at this table. So without diabetes, your A1C should be less than 5.7. Pre-diabetes is 5.7 to 6.4%. Now, pre-diabetes means that you still have the opportunity to make some changes and prevent the development of diabetes. Once you have actually developed diabetes, you can't get rid of it, even though you may be able to manage it with diet and exercise. You're stuck with that. But at pre-diabetes, there's a little bit of wiggle room. We can kind of push time backwards. Okay, so diabetes diagnosis is 6.5% or above. And then when you have diabetes, your goal is to get less than 7%. Now, these are general numbers, okay? That goal with diabetes changes for everyone. For my husband, his goal is actually 6%. But that may not be reasonable for somebody who has steroids and kidney disease and other complicating factors. And so, or somebody who just gets low all the time. You know, all of a sudden you have this drop in blood sugar, maybe we'll keep it a little bit higher. So those goals should be adjusted based on you and your health. But generally, we recommend less than 7%. And the reason we recommend less than 7% is because we know that if your A1C is less than 7%, your risk of developing wounds and loss of feeling in your hands and feet, that neuropathy, is greatly decreased. There is a much lower risk of developing problems if your A1C can be less than 7%. Okay. All right. Now, blood sugar. When should you test? So these are just common times for testing. If you have type 1 diabetes, that means you give insulin at every single meal. And in that case, you need to check your blood sugar before every meal. You check your blood sugar, you take your insulin, you eat your food. Okay. And then maybe you check 2 hours after, maybe not. If you have gestational diabetes, then you need to check your first blood sugar in the morning, your what we call fasting, which is 8 hours or more of without food. Okay, you need to check that fasting, and then 2 hours after every meal. Okay? And patients with gestational don't actually have to check before unless they have to use insulin. Okay? If you are on 2 medications, so say you're on metformin and glipizide, or say you're on just one medication, metformin, then we typically recommend that you just check your fasting blood sugar. And that's first thing in the morning. You haven't had, I mean, you could have water, right? You could have black coffee, but you haven't had anything with sugar or carbs in it. In that case, so that fasting blood sugar, your goal is to be between 80 and 140. Okay. Now, again, this needs to be tailored to each person, but the ADA recommends, the American Diabetes Association recommends a blood sugar between 80 and 140 first thing in the morning. Okay. 2 hours after a meal, this again is person specific. So with most of our individuals, we want it less than 180. Some individuals who want that really, really low A1C, they want it less than 140. Gestational patients, so pregnant moms, they need their their blood sugar to be less than 120 2 hours after a meal. So it really does vary on your situation. And then a lot of patients check before bed. Now, if you're on a medication like metformin, there's a very low risk of low blood sugar. But if you're on something like glipizide or insulin, or glyburide, those medications, there's a higher risk of low blood sugar. And so in that case, it can be important to check before bed to make sure that your blood sugar doesn't get low while you're sleeping. And so in that case, we say, you know, we'd like your blood sugar to be greater than 100. If you're doing diet and exercise controlled or metformin, it can really, I mean, it can get as low as 70 or 80 because your body will actually start to fix that low blood sugar on its own. But if you're on medications that lower your blood sugar, then you may want it a little bit above 100. Okay, when should you check your blood sugar? And we kind of reviewed this before, but when you first wake up, before you eat or drink anything, before a meal, 2 hours after a meal, at bedtime, and if you feel like your blood sugar is high or low. So high blood sugar can feel like you're extremely tired, you're really thirsty, and you need to go to the bathroom all the time. You're just constantly peeing and drinking, and the cycle goes on. And so that's a good time to check your blood sugar and see, okay, it's 250. Let me check in, let me go for a walk, drink some water, and let me check in half an hour and see what my blood sugar is. Okay. And if it's coming down, then you're on the right track. If your blood sugar is low and you're able to check your blood sugar, that's a great thing too. And we want to treat anything less than 70. So keep that in mind. Less than 70 is too low. You need to treat it. And treatment is half a glass of juice, 4 pieces of candy, or even a tablespoon of sugar will do. Okay, so what everybody wants to know, how do I check my blood sugar? Okay, we have 2 options here, and you'll see on the left, I'm sure you've all seen commercials about the Freestyle Libre. We're going to talk about that and other continuous monitors today. We're also going to talk about the traditional finger stick blood sugar meter. And we'll talk about them separately, and then you will have all the information so you can talk to your doctor about it. Okay, so it's called a glucometer or glucose meter. Most patients with diabetes just say, my meter, because they don't have another one. Okay, so this requires poking your finger with what's called a lancet. A lancet is a tiny needle that goes in, it's spring-loaded, and it goes into your finger and pulls out a tiny, tiny drop of blood. This measures your blood glucose at one point in time. Remember when we were talking about blood sugar, what is it right now? And so this monitors when I stick my finger, it's telling me what my blood sugar is in this moment. Okay. This is ideal for patients who only need to test once a day. Again, if you're on metformin, if you're on 1 or 2 pills, your doctor will probably say, you know what, check first thing in the morning. If it's between 80 and 140, we're happy. Okay, so in that case, a finger stick is perfect. It's also good for patients who have cost concerns about the continuous monitors that we're going to talk about in a minute. And they can be a little costly for some patients. And then there are actually patients that just prefer to use the finger stick instead of having something attached to them, which we'll go into again. And so this is the traditional way of monitoring blood sugars. It's been used for many, many years, and it does provide good information. And you can buy these, well, we'll talk about it a little bit more, but you can buy them over the counter. You can you can get a prescription for them for cost. There are lots of options. Okay, so let's go through how to use a glucometer. And I actually have one here, and I'm going to demonstrate this for you. Now, I just ate not too long ago, so don't judge my blood sugar, okay? Keep in mind. Now, I don't have diabetes, but blood sugar still varies with diet. So I'm going to face my camera down a little bit so you can see what I'm doing here. I am just going to show you one type of meter. There are many out there, but I'll try and point out a few differences as we go. Okay, so you see my meter here. Okay, it's probably a weird angle, but we'll kind of go with it. All right, so I've already washed and my hands with soap and water. They are clean. And now I'm going to start by taking a test strip. It comes in this little canister, looks like a film canister. And I'm going to take out one test strip. Now you see this test strip is gold on one side and white on the other. It has a forked end and it has a flat end. Okay. And you see this tiny little gold strip on here? That is where I need to put my blood. Okay. All meters, when you put the test strip into the machine, they turn on automatically. All right. And you can see it already says, good afternoon, let's test your blood sugar. Okay. And then it tells me where to put it. Now, not all meters will show you where to put that blood, but this one does. This is most commonly covered by Medicare and Medicaid, and actually really well covered by most commercial insurances. For this one, you're going to put the blood on the side of this little bitty gold strip, okay? Other meters, so this is the only meter actually that you put your blood on the side. For most meters, you put your blood on the tip. Okay. All right. So you also have an end that's metallic looking, or it may look like a computer chip, you know, like old floppy disk kind of looking. So we're going to take that in and put it in. If your machine doesn't turn on, it means you have the strip in the wrong way. So take it out and turn it around. Okay. So that's on. Now I need to prick my finger. So I'm going to take this lancet device. Okay. And I'm going to twist the top off. Some pull straight off, this one twists. And then this is a lancet. Okay. So I'm going to stick it in. These only fit one way. So if it's not going in, you have it the wrong way. So just flip it over. And you can see if I turn it over this way, it doesn't fit in. Okay. So I put it in here and I'm going to twist the top just so it breaks that plastic a little loose, and then I'm going to pull it off. And I don't know if you can see this. There's a tiny little needle right there. Then I'm going to put the cap back on. And all of these have a spring, and you need to cock that spring. So this one I pull down like that. Others you may pull the bottom down, or the whole thing shifts down. This one is just on top. Okay. This green button is what's going to stick my finger. So I'm going to take it and I'm going to press firmly on the side of my finger, not all the way on the side, but just off center, right there. And I'm going to push the green button. Now, I didn't feel anything, which means that I don't have a deep enough level. So right here, you can see this little green box, and you see the 1. I need to turn that, for me, I need to turn that up to a 3. Everybody's a little bit different, but I know what mine is. So I'm going to turn it up to 3, and I'm going to pull back again. And I'm going to put this on my finger, and I'm going to push the green button. Well, I felt a bit, but no blood came out. So now I'm going to go up to 4. Okay, so I turned it up to 4, pull back, put it on my finger, and stick. Woo, felt it that time. And look at all that blood. Okay, so now I go to put it on my meter, and my meter is turned off. That's because it took me a minute to get the blood. So I'm going to take the strip out, and I'm going to put it back in, and it turns back on. And I'm going to wait until it tells me apply some blood. So now I take my finger and I squish some blood out. Nice amount of blood. And I'm going to just touch it to the edge. See, I'm not putting it on top. I'm not putting it on top of it. I'm touching it to the side. And it sucks that blood right into that little line. And now I'm going to back away and get a tissue real quick. Okay. And you can see it's counted down, and it's told me my blood sugar is 119. That's not terrible for having eaten recently. And you see I took the strip out and it turned off again. Okay. So remember I said 2 hours after a meal, it should be less than 180. So I'm right in that range. Now I'm going to put all the pieces back together. I'm going to take this lancet out. And you see here was the top that I took off earlier. I'm just going to stab this little lancet in there to cover the tip so we don't have any sharp objects. Then I'm going to push it out. Okay. And then I'm going to put the cap back on, and it's ready to go. Okay. They come in these black cases, which you will inevitably lose in between your couch cushions. But this is how you use a meter. Okay. So I hope that helped explain how to check your blood sugar with a meter. So how to get a glucose meter. If you want insurance to cover your meter, then you need a prescription for it. Okay. So most insurances will cover all or portion of the cost of your meter. Sometimes that copay that you have with that prescription is high. For example, my husband's copay was going to be $50. In that case, I say, you know what? Let's go down to the over-the-counter section. Look down at the green one. And it says if insurance doesn't cover a meter, you can buy one at any pharmacy. And the most affordable one is at Walmart. And so you go to Walmart and you look at the Rely On brand meter, and it's $9 for a meter. And for 50 test strips, it's also $9. And so that can actually cover, if you're only testing once a day, that's almost 2 months worth of strips. So use your own judgment. If your insurance covers it, that's great. If you're paying a lot of money for test strips, maybe go to Walmart and get one. Okay. Online, you have several options. There are lots of medical supply companies. And insurance may want you to go through a medical supply company to get your meter for the best price. There are also other companies that you can go through. You can go through the brand One Touch. You can go to their website and buy them. You can also get a subscription. One Drop is the most popular subscription. You pay $80 a month. You get a meter and a kit, so with the Lancets and everything. You get unlimited test strips for a month. So if you're testing a lot, that can be a really good price. Amazon Prime, sorry, is not a prescription, but that's another place you can get it. If you have Prime, you can get the CareTouch meter, and it's the same cost as the Walmart meter, but they just ship it to you for free. So that can be another option. Okay, so you have lots of options to get a meter. You can either get it prescribed or you can just go buy one. It's nice to kind of have that flexibility. Okay, sorry, I have to keep moving my picture here. Woo! Okay. Sorry, guys. Okay, so what's a continuous glucose monitor? A lot of you have seen these commercials on TV where somebody has the little thing on the back of their arm and they use their cell phone to check their blood sugar, or they have something attached to them and it just updates their blood sugar. There was one during the Super Bowl that was advertised called the Dexcom G6, which we're going to talk about. I think one of the Jonas Brothers advertised it. I'm not sure. But that's one of those sensors. So this is a device that is attached to your body for 10 to 14 days. It is waterproof, so you can shower with it, you can swim with it. Apparently you can scuba dive up to 50 feet if you want. You apply it yourself, so you don't have to go to your doctor and get it put on. You just do it at home. It continually checks your blood sugar throughout the day and night, and it can actually show trends in your blood sugar. So if you're looking at these blood sugars throughout the day, you can say, oh, okay, every afternoon at 2, my blood sugar gets low, and every morning at 3 a.m., my blood sugar shoots way up high. And your doctor can actually help you manage your blood sugars because of those trends. I do want to clarify, this sensor does not give insulin. That is an insulin pump. A sensor is just checking your blood sugar. Okay. This is ideal for people who test multiple times a day. So, if you're testing once, sure, stick your finger every morning. I just did, and it was fine. But if you're testing 3, 4, or more times a day, this can be really beneficial. It's great for patients who are trying to get better control of their blood sugars. So if your blood sugars are constantly running high and you just are struggling with trying to figure out what's going on, this can tell you so much more information than just 1 to 2 tests a day. It's also really great for patients who have consistent low blood sugar. We all have family members that all of a sudden their blood sugar drops and they're shaking, and it's scary. And so this can kind of help you prevent those low blood sugars. I have patients that I see on a regular basis that have difficulty using a glucose meter because of some physical abilities. One patient that I had to see, he had a stroke and wasn't able to use one of his hands. So that makes it very difficult to check your blood sugar when you need both hands. Another patient broke his whole elbow. Whew, they had it like immobilized in a cast. It looked very painful. That makes it very difficult to check your blood sugars. And so this can actually help. Even if you don't use it all the time, it can help during that period. It's also ideal for patients who do use an insulin pump. My husband has an insulin pump, and it helps him adjust his insulin based on that continuous monitoring. Okay, so let's talk about the 2 most common. There are other brands. Medtronic is a brand that has is a company that has a continuous monitor. There's one called Eversense. That's another one that is kind of gaining some popularity. But the most well covered by insurance are the Freestyle Libre and the Dexcom G6. So let's look at the Libre first. It has an applicator, so you can put it on yourself. It stays on for 14 days, so 2 full weeks. You can check your blood sugar with most smartphones, or you can get a reader, which is shown here in the picture. Okay. You do have to hold the phone or the reader close to the sensor to get a reading. So the original Libre, which it still works, it's just the first version, it can use a smartphone or a reader. And you check your blood sugar as often as you want. The Libre 2 is the updated version, and it actually alarms if your blood sugar is low or if it's high, which is really nice if you're somebody who doesn't notice that their blood sugar is low until it's in the 60s. Okay. It cannot be used with a smartphone at this time. They keep telling me in October, we're going to have an app for the phone, but right now we don't have that app. It is just the reader. So the Libre 14-day sensor you can use your smartphone with, but it doesn't alarm. The Libre 2, you have to have a reader, but it does alarm. All right. Now let's switch to the other side, the Dexcom G6. This is a difficult name, but this is a great system. This is actually the one my husband has. Now, I'm not biased. I mean, I am a little bit biased because my husband uses this one, but I think that they're both great and they both have great applications based on insurance coverage and what you need it for. If you're on insulin, I highly recommend the Dexcom G6 if your insurance covers it. If you're on pills or insulin once a day, then I think the Libre is going to work great for you. So it's all about insurance coverage and really your situation. So the Dexcom G6 also has an applicator, and that's this big white thing. Okay. It stays on for 10 days instead of 14. And you can check your blood sugar with most smartphones. It does come with a reader as well, but it actually automatically checks your blood sugar every 5 minutes as long as your device is in the same room. So you have the sensor on your arm or your belly, okay? And as long as your phone is somewhere near you, it's going to check your blood sugar, okay? And then it alarms if it's high or low. Also, it has an option for followers. So with my husband's, if his blood sugar is low for 15 to 20 minutes, it lets me know. Now, I can set it for the first time it's low or anything like that, but my husband manages his blood sugars. I don't need to worry about that. But if his blood sugar is staying low, that's a reason for me to be a little concerned. Do you need help? You know, I can reach out to him and say, what can I do? Okay, so the Dexcom checks every 5 minutes, alarms if you're high or low, and goes to your phone. The Libre, you have those 2 Libres, one alarms and one doesn't. So let's talk about coverage. Excuse me. For both of these, they require a prescription. Your doctor has to send in a prescription. Hopefully in the future, we will have an over-the-counter option, but we don't at this time. For commercial insurance, this is your insurance through work, like your Blue Cross Blue Shield, your Aetna, your Cigna, Ambetter, all of those are considered commercial insurances. Most insurance will cover a sensor if you've been diagnosed with diabetes. They all have their preferences. So I've called in a Libre and they say, no, we won't cover that, but the Dexcom is going to be $0. Okay, so it really is kind of hit and miss, and your doctor may have to call in one or the other and see if it's covered. The Libre and the Dexcom can both be ordered. Copay for the Libre ranges from $0 to $74.99 with insurance, okay? The most common is that $74.99 a month, but every day I see somebody with a copay of $10 or $15. All insurances are different. You can call your insurance company and ask them what the copay would be ahead of time if that's easier. For the Dexcom, the copay ranges from $0 to $300. This one is a little bit more expensive system, but I do see patients with I've seen one with a $40 copay. I've seen one with a $0 copay. It really depends on your insurance. Okay. The cost may decrease if you have a deductible. So the first month you pay $74.99 and then the second month you pay nothing. It really is very insurance specific. Okay. All right. For Medicare, you have to go through what's called a durable medical equipment company or a DME company. Medicare will cover it if you meet the requirements. Okay. The first requirement is 1 month of blood sugar readings 4 times a day. Now, during the COVID emergency, they will allow 1 month of blood sugar readings once a day. And so keep in mind, once you get covered with Medicare, they will continue to cover it even if you don't have those readings. Okay. So if you're considering getting one of these, now is the time. Now, pay attention to the second requirement too. You must be prescribed insulin shots 4 times a day. So if you are on metformin only, and Medicare will not cover either the Dexcom or the Libre. Okay. But if you're on 4 shots a day, if you're prescribed that, they will cover it. Now, again, during COVID, if you're prescribed insulin once a day, they will cover it. So right now, you only need to check your blood sugar 1 time a day and take insulin once a day, and you are qualified. Once that COVID emergency period goes away, which we don't know when that's ending, okay, then you will have to write down your numbers for 1 month, 4 times a day, and you need to be prescribed insulin 4 times a day. Okay, your doctor then sends a prescription to your DME company. So what you do is you call Medicare and you say, hey, what DME company should I use? What do you prefer? And they'll tell you the name of one. Okay, Edge Park is one that's commonly used in this area, and Edge Park Durable Medical Equipment Company. Okay. Generally, the copay on these is pretty small if those requirements are met. All right. Now let's jump down to cash pay. So let me actually make a side note real quick. Medicaid does not currently cover these unless you have type 1 diabetes. So if you have type 2 diabetes, even if you're on insulin, Medicaid does not cover them, but commercial insurance and Medicare do. All right, now let's jump down to cash pay. Let's read this orange tab, okay? So this only applies to Libre and Libre 2. Cash pay for the Dexcom is, I think, $300 a month. Okay, so that's very, very expensive. You can still do it if you just have that money around, but ideally we wouldn't do that. Okay, but for the Libre and the Libre 2, they are both the same cost. You need to use a GoodRx copay card, so here is something that I have learned in diabetes education. If you go online to GoodRx, which is a copay card, it's free. You just sign up for it, or you can get a printed one at your pharmacy. If you go online to their website and check the price, it will say that this is $120. But if you actually take it to the store and they process it at the pharmacy, then you will find that at Walmart, you can get a month's supply for $67. Now remember, the Libre lasts for 2 weeks. So that means for $67, you get 2 sensors. Okay. At Hy-Vee, you can actually get it for $65 for 2 sensors. So that doesn't fit into everybody's budget. Some patients are like, I am so tired of sticking myself, I will find that money. Other patients, they cannot stretch their budget that much, and that's okay. But I just wanted to let you know that this does exist, okay? So for the Libre and Libre 2, get a GoodRx card, which is free, and then go to Walmart or Hy-Vee. It still requires a prescription, so your doctor needs to call it into those places. Okay. Okay, that was a whirlwind of information about blood sugars and blood sugar monitoring and CGMs, which is the continuous glucose monitor. And I hope you found that information useful. And please reach out to me or my colleague, Melissa, if you guys have any questions. We are happy to answer those. We're happy to assist you in finding the right sensor for you or the right meter, and if that's the case. Okay, so Shanna's gonna give you that information on those numbers that I had up there and the instructions on how to check your blood sugar. And I hope you all have a wonderful day.